Well, a warm welcome to today's talk, Sunday the 13th of March. Now, we've got some pretty good figures on excess deaths for the pandemic period now, and it's well in excess of 18 million. It was just over 18 million by the end of 2021, and that's compared to an official death rate of about 6 million altogether for the world. So it looks like about 18 million people, and unfortunately still counting, the excess deaths as a result of this pandemic. Now let's look at how this was derived. Now this is a fully peer-reviewed paper from The Lancet. All there, you can download the PDF for yourself, completely available. And this comes from the Institute of Health Metrics from Washington State, Washington University. It's an independent agency within the university, and the data is actually available there if you wanted to have a dive into the data yourself. So let's look at this and where it's come from. So it's estimating excess mortality. There are all the references. We strive to be evidence-based at least. So it's January, that's the very start of the pandemic, isn't it? January 2020. And the data's up to the end of 2021, so no 2022 data in there. Estimating excess mortality from the pandemic, 191 countries and territories. It's an impressive piece of work, this. I'm glad I didn't have to peer review it. Let me just show you some of the graphics here. I mean, these are all the countries and lots of figures about them. There's just pages and pages of it. Must have been a nightmare to peer review, but it is all fully done. So if you want particular data on particular parts of the world, it's all there, and it's all readily available, free to download. So lots of area, 12 states in India. There's 28 states in India, so they didn't get the full India data. What they did have to do in some parts of this, they used quite clever statistical models to interpolate and to some extent extrapolate data where it was missing. All the details are in the article. I don't pretend to understand them all because I'm not a statistician, but it all looks pretty impressive. So data collected for the pandemic period and past 11 years. So sometimes it's 11 years. Now, Office for National Statistics, for example, in the UK, when that's giving data on excess mortality, it's the average for the last 5 years that it takes. So this went further where the data was available, and quite often there was a certain amount of data available. All-cause mortality reports. Excess mortality over time was calculated as observed mortality minus expected mortality. Now this is quite good, but this is the way they did it. So the excess mortality, the number of people that died more than normal, equals to the observed mortality minus the expected mortality. So what they actually saw, take away what they expected, was the excess mortality. So quite clever, really, and quite sophisticated the way they collected this for so many areas. Major piece of work. They accounted for late registrations. They used different models, and they accounted for heat waves and other factors. Really quite impressive, actually. Findings as measured by excess mortality. So as of the end of 2021, there was basically 6 million people reported to have died of COVID. Their estimates for the excess mortality is 3 times that. It's 18.2 million. Now, this doesn't tell us what they died of. Does this mean that deaths from COVID were greatly underreported? Yeah, certainly we know that's true in many parts of the world. Or does it tell us that other people died as results of the lockdown measures, or as other measures that were taken to fight the pandemic? Or is it that there was more violence, or is it that there was more alcohol and drug abuse? Or is it that, and this is certainly true again, that many people were not able were too frightened to access healthcare? So it doesn't tell us that, it just tells us these numbers. But the estimates it gives, again, based on quite sophisticated modelling, and I must say the modelling in the United States, certainly in Washington State University, does seem to be better than, let's just say, some institutions that could be mentioned in the UK where our modelling has been, suboptimal at times, but the Institute for Health Metrics and Evaluation does seem pretty good. So excess mortality, 17.1 to 19.6 million. Global all-age rate of excess mortality due to the pandemic is 120.3 deaths per 100,000 of the population. excess mortality rate exceeded 300 deaths per 100,000 of a population of the population in 21 countries, which we'll look at. Now let's look numbers. This is numbers first of all. Cumulative excess deaths due to COVID-19. Now this is numbers. India 4 million people, but of course India's got a population of 1.4 billion, so obviously you would expect that to be highest. United States 1.13 million, and remember this is excess deaths as calculated. This is not that which is recorded in official data, it's as calculated. Russia just over 1 million, Mexico 798 100,000, Brazil 792, Indonesia 736 600,000, Pakistan 664 100,000. I'm not going to do these in great detail, but these are going down in order, of course. Bangladesh 413,000, Peru 349,000, South Africa 302,000, pretty high death rate in South Africa really. Iran, Egypt, Italy really quite high, surprisingly high, 259,000 people in Italy, 169,000 excess deaths in the UK. Canada, New Zealand. Now New Zealand and Australia, notice these are negatives. They're both negatives. So the excess deaths in New Zealand during the pandemic period were 827 less than you would expect, and in Australia it was 18,100 less than you would expect. So they're the only countries I've found on the list that are in negative territories. And then more in terms of per capita, so excess mortality per 100,000. So excess mortality was highest in Russia. 374.6 deaths per 100,000 of the population. Mexico was next, 433, then Brazil, then the United States, 179.3 per 100,000, UK 126.8, Canada 60.5, and again Australia and New Zealand both in negative territory with less people dying than would be expected. Now, I was surprised that India wasn't in this, because we did look at these horrific videos and horror stories from India of the people being buried along the Ganges and terrible things like that. But that's because of the very large population in India. Actually, the most deaths per 100,000 were in Russia. We have suspected it was high, but we didn't know it would come out the worst of the bunch. Well, the highest, of course, is the worst. Now, that is what this data is showing. It reminds me of videos we've done over the past couple of years, actually, where we did anticipate some of this, but there are always surprises. But Russia's not too much of a surprise. Ratio of excess mortality rate due to COVID-19 mortality. Now, how wrong did people get it? A measure of the undercounting of the true pandemic mortality. So Morocco undercounted their deaths by a factor of 10. So if you assume that the excess deaths is the right number of deaths, and the number that are actually reported, then there was actually 10 times more excess deaths in Morocco compared to the actual reported number of deaths. Egypt, it was 12.9. Sudan, it was 25 times. So 25 times more actual excess deaths in Sudan than officially reported from COVID-19. Afghanistan, as you would expect, high. Yemen, of course, is a war-torn country, so some of those could have been due to the war, as well as massive underreporting, of course. Canada, 1.44, so Canada only slightly underreporting. United States, 1.37. And the United Kingdom actually slightly underreporting. Now, the interpretation of this... The direct quote from the authors, the full impact of the pandemic has been much greater than what is indicated by reported deaths due to COVID-19 alone. We know this, we've known this for a while, but we didn't realise it was ×3 higher globally, so it is a lot. And further research is warranted to work out what the heck is going on. Is it caused by collateral damage, or is COVID-19 and its various strains, various waves, been more pathogenic than we originally thought? So things still to be worked out there. Do remember the average death age in the UK is 82.5 years of age. So this is still primarily affecting older people, as we know. And if we just look at the couple of figures from the United Kingdom here. So this is where COVID-19 was the underlying cause of death. So this is the deaths from COVID or the deaths with COVID. So these are the deaths from COVID. These are the latest figures. About 75% would have carried on living had it not been for the COVID episode. And about 25% dying with COVID. That's in the UK. But of course, we have to bear in mind, as we've said, that the average age of death with COVID in the UK is 82.5 years of age. So I think it's sometimes useful to look at the amount of years of life lost, and clearly, because it's older people, predominantly older people dying, the years of life lost are less. Whereas with the First World War, which people are making analogies with, so 15 to 22 million people died in the First World War, but they were mostly young combatants. And if you walk down the war graves in France, as I do from time to time, and you read the ages, 18, 19, 20, 21, 22, typical, very, very young men typically. So a lot of years of life were lost there. And I go there every few years. If you've never been to the war graves, do try and go. I always have to walk off up and down the rows by myself, and I always cry every time. It's such an impact. You know, if you want to know a little about the nature of war, albeit in that very neatly groomed circumstance, do go to the war graves if you possibly can. Which of course reflects current situations as well, doesn't it? But the point is I'm making, that was mostly young men, so they lost a lot of life. In World War II, of course, there was massive civilian casualties. 1918-19 pandemic, again, a lot of younger people died. There was an excess of deaths in the teenage years as well as in the older years in the 1918-19 pandemic, so much less years of life have been lost. But we still need to know much more. So, but looking back, aren't we fortunate that this virus didn't selectively kill children, for example? It's not impossible that could have happened, but it didn't. So we need to work out whether it's to distinguish excess mortality that was directly caused by SARS coronavirus 2 or the chances of deaths indirect. And another thing that's probably is going to happen is there's almost certainly going to be an increase in cancer deaths over the next few years, probably everywhere, from people that didn't seek healthcare during the pandemic and delayed diagnosis. So these repercussions are going to be with us for years to come. But anyway, getting back to the to and from, that was that figure. And then I think the other thing to bear in mind is this is UK data, so we can't extrapolate this to the world, of course. But the proportion of comorbidities. So in the UK, the most common one was, that's 30%, that's 20%. So about 22% of people dying had diabetes as a comorbidity. And these other comorbidities here, as well as age, of course. And again, still about 17% COVID-19 cases with no pre-existing health conditions. So there we go. Excess mortality over 18 million. Now, of course, we're now 2.5 months into 2022. So this number will increase. Interesting to think about. So given that we don't really know how many of these deaths are COVID attributable and how many aren't, will we ever know this? Probably not. Is it true, or is it possible that more people died of the measures that we took to restrict the spread of COVID-19 than actually died of COVID-19 from these excess deaths? That is possible. I don't think that's going to be true. I think a lot of these deaths are underreported COVID-19, but there will be a large proportion, as we've said, of deaths caused by the measures that were taken and devastating economic impacts in some parts of the world. So whether we'll ever have a full breakdown on that is doubtful. We might have more accurate estimates in time. But the key thing is really that we learn from this pandemic for the next one, because there will be a next one. And and it could affect much younger people. It could be much more deadly. As we've said many times, it could be as transmissible as measles and as deadly as Middle East respiratory syndrome, which has got a very high mortality rate, or as deadly as Ebola. That is possible. And of course, in the current climate, the other thing that's really concerning, I mean, we've debated many times on this channel whether the SARS coronavirus 2 came from a lab or not. From the data that we can get, unless our intelligence services are completely lying to us, which I suppose isn't entirely impossible, but I don't think there's any strong data to suggest that they are. I don't think, and most virologists around the world don't seem to be jumping up and down about this. I don't think this is a bioengineered virus. I don't think it was designed in a lab to be a pathogenic virus. Whether there was gain of function research to study the virus is much more probable. Whether the virus accidentally escaped from a lab, possibly in Wuhan, is quite possible. Whether we'll ever know that again, I don't really know that. But what is concerning is we do believe that virological institutes around the world have engineered viruses. And this could be in Russia, it could be in the United States, it could be in the United Kingdom, it could be anywhere, that are actually could be used as biological warfare agents. And human beings are quite capable of designing a virus that is capable of eradicating, well, I don't know, 90% of the world's population in a few months without being too alarmist about it. If it was designed to do that, I suspect it probably could do that. That's quite an alarming possibility. We know that smallpox is kept. The smallpox in Porton Down in the UK, that is known. And of course, we have to keep smallpox, because if the bad guys release smallpox as a chemical, as a biological weapon, we would need our smallpox supply to put that into cellular cultures, so that we could produce our own modern, up-to-date vaccines. So we need to keep smallpox because the bad guys are keeping smallpox. But of course, the bad guys who might think they're good guys are keeping smallpox because they think we're the bad guys and we're keeping smallpox. So no state secret, there's smallpox, and I'm sure there's smallpox in a couple of places in the States, stored in the lab, of course, and certainly in the UK, and there has actually been the odd episode of escape. So it is a concern. But apart from that, the possibility of another zoonotic pandemic is a certainty. It's just a case of when. So hopefully we've learned something from it. Although so far I don't see too much indication that we have. What we have done is, certainly in the UK, we've instigated and accelerated more vaccine production facility. And Canada, for example, which had no indigenous vaccine production capacity at all, I believe they're now instigating some. So vaccine production should be quicker next time. But whether we've learned from other things like, I mean, I don't want to go over too much, but, it was back in February 2020, on this channel we were saying close all flights from China. Close all flights from China. If that had been done, we probably wouldn't have had a pandemic, but the World Health Organization said, go ahead. So have they learned from the mistakes? Well, maybe the first step to learning from the mistakes might be admitting their mistakes, and there's no sign of that really. So just a few reflections. I suspect most of you are switched off by now, but if you're still here, thank you for watching.